This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, guys, this was a case. It was a 90-year-old female with a history of small bowel cancer, and she occasionally gets abdominal pain and came in by EMS for abdominal pain. She got some pain meds pre-hospital and then was here. A nurse came to me and said, hey, she's miserable in there. So I went in there and she is writhing in pain. She looks absolutely horrible. I said, that doesn't make a lot of sense. So we gave her more meds. She did not get better. She's 90. She's already had a milligram of Dilaudid at this point. And her monitor looks like she's a new AFib. And when you push on her belly, you really can't elicit tenderness. So you have what we would describe as pain out of proportion to exam with new AFib. So does anyone know what diagnosis you should be thinking about?
Ooh, dissection.
Dissection's a good thought, but not this one. For this one, it would be acute mesenteric ischemia. So people look horrible, but when you push on their belly, they're not focal like they have an appendicitis, pain in one spot. So we added a lactate, which you would anticipate if she had it to be elevated. Hers was normal. But we went ahead and did a CTA abdomen pelvis, and she had a thrombus in her SMA, a complete occlusion of the mid and distal thrombus. Her bowel was not edematous. Her lactate was normal, so she got started on heparin and admitted to the medicine service with a surgery consult, and this was thought to be embolic in nature. So it turns out she had new AFib, and the AFib, she threw a clot and it landed in her SMA. So the take-home points for this diagnosis are you look for pain out of proportion. So when you're sitting in there and you go, why is this person in agony? It doesn't make sense. Either they're one, lying to you, which happens frequently, or two, their gut is dying, and that's what was happening in this case. And so she did fine. She'll get anticoagulated, and the thrombus should self-resolve with anticoagulation.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.